Good afternoon. I'm Dr. Ananda and I'm an orthopedic surgeon from Orthocare Orthopedics and Sports Medicine. We are located in Mauni Novena, Farrer Park Hospital and Parkway East Hospital. And today we're talking about bunions.
What is the primary causes of bunions and how do genetics and environment contribute?
So the primary cause of bunions is multifactorial. So most of the time we do see that there's a genetic element in bunions. But what the genetic element actually predisposes the patient to is something we call ligament laxity. And this is a condition in which your ligaments in your body, the muscles, the tendons, tend to be a little bit more lax compared to strong. And therefore, they tend to take the path of least resistance and they get stretched. And that's how bunions typically develop. So it's not very uncommon as part of the disease process. Sometimes we see bunions in patients with flat feet. And oftentimes, you also can see that patients with bunions, maybe they even have a curved spine, scoliosis, and they usually can complain of back pain, knee pains even, because it's essentially something that is involved with the laxity of the ligaments. However, notwithstanding, there are some patients who may not have laxity of ligaments, but they do develop bunions, and this is usually from environmental factors such as maybe a very long history of wearing tight footwear, probably poor footwear choices. These are some of the typical contributing causes for bunions as well.
What are the common signs and symptoms of bunions?
Okay, so typically a bunion describes a deformity of the big toe. And this deformity is usually noticed by a patient as a bump on the bone on the inside of the foot where the big toe is. So typically when patients do notice this bump, they probably would have a bunion, and many a times the bunion may not be symptomatic in the sense that it's not causing pain or any issues other than maybe sometimes in some patients it may cause difficulty in wearing shoes or finding a proper size of shoes because their foot is essentially quite wide. So in those patients, then the symptoms can be that the rubbing of the shoe causing pain, swelling, redness, and these are what we call symptomatic bunions. And this is when patients might need to see someone to just basically assess them and decide on a proper way of treating these bunions.
Are bunion correctors effective at managing symptoms or slowing the progression of bunions?
Yes, certainly bunion correctors can help to prevent the bony bump from being very obvious, but these are very temporary measures, and typically if they are not wearing the bunion separator, the bunion will appear again. And it is not really effective in preventing the progression of the bunion. The bunion tends to get worse over time because of worsening ligament characteristics, and the ligaments become more lax over time, and the biomechanics of the walking and the predisposing factors actually make the bunion worse. So bunion separators may not be that effective in actually alleviating the root cause of bunions.
When should I consider bunion surgery and what factors matter?
Okay, so surgical correction for bunions can be considered if conservative measures such as bunion separators or insoles for flat feet have failed to prevent the bunion from getting worse, either in the severity of the deformity that has gotten worse or the symptoms of pain that may be affecting either the big toe or the lesser toes such as the second, third or fourth, fifth toes. Then surgery can be considered. Surgery can also be considered if, let's say, patients have difficulty finding proper shoe wear because the shoes are too tight for them. So these are some of the factors that can be usually considered as worsening of the bunion, and maybe a surgical correction may be useful in preventing the bunions from getting worse.
What are common bunion surgeries? Procedures and their price range?
Before we advise patients for surgery for bunions, we usually would examine them and probably even order some weight-bearing x-rays to assess the severity of the bunions. The most common surgical procedure that I tend to do for my patients with bunions is minimally invasive surgical bunion correction. Now, this is something that is done through very tiny incisions, and using special instruments, we're able to correct the bunion and keep it in place. And we usually tend to do this surgery with the aid of x-rays during the surgical procedure so that we know that we're correcting the bunion, and there is basically an x-ray to guide us during the surgery as well.
Tell us about post-surgery care.
Okay, so typically after surgical procedure done for bunions, the patient can walk the next day itself. They usually need to use a special set of shoes to be able to walk, and we usually will put them on some dressings that help to keep the bunion corrected. For the first 2 weeks, of course, they need to keep their walking to a bit of a minimal distance. And when we see them after 2 weeks, we will usually remove the dressings, and we will actually usually take off the stitches. We will then refer them for some physio, because physiotherapy is important to help to reduce post-op swelling and also to get range of motion of the big toe. The typical healing period for bunion surgery is usually about 6 to 8 weeks, and usually we will repeat some x-rays at that point in time to actually assess the bone healing after the surgery.
How important is it to choose the right footwear in preventing the development or worsening of bunions?
So typically, when I see patients with bunions, almost about 80% of the patients with bunions usually have some form of low arch or flat feet. And it is very well known that low arch and flat feet can actually make bunions worse in the long run. And I would usually advise them to actually try to address the low arch and flat feet by instituting some insoles for the footwear that they wear. In addition to that, the other thing that I usually advise my patients to do to actually help to prevent pain or worsening of the bunion is basically a lot of calf stretching exercises, because this helps to redistribute the forces on the forefoot, and that will go a long way in helping to prevent this bunion from becoming worse as well.